We still do not have any confirmed case in Kenya as at now. Yes, we have had samples that have been taken, but all that have been taken to our labs have turned negative. Again, we have also had a lot of screening being done at the border points. We already have more than 12,000 travelers that have been screened for Ebola virus, and more than 10,000 travelers that have been screened from the international scenes. Domestically, more than 2,500 travelers, and also another more than 2,000 who are also passing through various other border points. So cumulatively, more than 10 million travelers have been screened in our border points or entry points. And we will continue screening anybody who is coming into the country just to ensure that we are safe, and the people who are also entering our country. If you're coming from the high-risk countries, then we propose isolation for a period of time so that we are able to take proper measures on what should happen next. All laboratories now that can test for Ebola. National Public Health Laboratory. We have Kemri Nairobi, Kemri Kisumu, and mobile laboratories because we remain a high risk of importation of the same due to the positioning regionally where we are. Again, incident management system at the national level and also at the counties, we are operationalizing similar incident management systems. Again, the national and county teams are working very closely and especially crossing that are at the border points. We have also strengthened a lot of border cross-border coordination with Uganda and DRC, Congo, regional and also international partners. We have been able to call them together. It would be good to remain calm until we give official communique, and I think that is on course. At the health facilities and communities, and this has been enhanced because it would be important to keep track on what is happening. Also, our rapid response teams are on the ground, and especially at the border points, including today, even when it is a holiday, our teams are on the ground. And you'll also be seeing me going to the border points to check the level of preparedness and also to ensure that we are getting what is required at the border points. We have also directed the counties to identify and operationalize isolation centers. Should there be any case in any county, they should have capacity to at least have an isolation point where the patient can be held. On the issues of the labs, I've already told you that we already have capacity in our laboratories. And like when COVID was there, we could send our samples as far as South Africa, but today we can test here in our country. So we have strengthened the laboratory preparedness and diagnostic readiness through the National Public Health Laboratory that we have in Nairobi. The laboratory capacities have also been mapped out, and we have also identified if there is any gap that needs to be fixed within our time. So we also have current laboratory testing kits and PPEs which are ready, and we have put together the personal protective gears. We have coordinated with our partners to also make sure that our healthcare workers are protected as they continue to work. A total of 880 national and county healthcare workers have been sensitized, and we are continuing to train them on what to look out for, because again, without the healthcare workers having the critical knowledge and the skill on how to deal with the disease, it can also be a challenge. So we are working very closely with the county governments, and preparedness simulation exercises and drills, they are also planned for high-risk counties to assess the readiness and strengthen the response capacity, and especially with the healthcare workers. Therefore, as a country, I would really wish to ask for calm, and we only let us not spread rumors. Let us be on high alert of signs and symptoms. And if you feel you are unwell, please go to a health facility. Do not start treating yourself at home, because that could be the beginning of the danger. It would be very important that the members of the fourth estate, you also help us to spread information, risk communication to the members of public, so that we can also array the fears that could be there with the members of public. But as at now, I want to assure Kenyans that we are on high alert, and we will continue giving information and only believe the information that is coming from the Ministry of Health.
About it, the next thing we hear that we are going to be having quarantining people who've got Ebola. I want to say clearly and categorically that in Kenya we have the right. One thing that I'm sure is that we did not onboard anything about quarantining people from other countries in our country, so that we can endanger our own medics, endanger our own people to getting diseases. So we want to say, Americans, have your people taken to America if you do not want them to be they've been infected with Ebola. You either fly them to America or you fly them to another country. But I want to stand with the Kenyans who are saying, we are saying no to quarantining in Kenya, because our country, we are people who want to keep our health and want to keep safe.
It is astonishing that William Ruto and his administration can listen to America saying that they do not want any infected person because their policy is to protect Americans first. How dare them entertain the idea that they can bring Ebola-affected people to Kenya to protect America but endanger the Kenyan population, when he swore by the Bible that he will obey the Constitution, which commands him to take the best interests of Kenyans into consideration before any decision. We thank the court, but I'm telling Kenyans, we are on our own. We must rise up and refuse to be used and to be endangered by recklessness of the Ruto administration.